Okay, so the next session is focused on how to respond to emergency situations when living with exstrophy. The discussion will be led by Pam Artigas and Jack Weaver. Dr. Weaver is a pediatric urologist at Cleveland Clinic Children's Hospital and a physician scientist with a growing focus on the use of artificial intelligence in medicine. Dr. Weaver, thank you so much for traveling all this way and spending time away from your young family to join us.
Oh, well, thank you, Ted and Pamela, for having me. This has been a really great day. Yeah, as Ted said, I'm a pediatric urologist at the Cleveland Clinic, and interestingly, I also have a history of classic bladder exstrophy. I went into pediatric urology because I had such a great experience growing up. Had a really great surgeon named Jack Elder, had incredibly supportive parents who, George mentioned earlier his relationship with his dad, and completely agree with that. I'm here because of my parents and because of Dr. Elder. So, Dr. Elder was my hero growing up. I went into it because I thought if I could have the impact on a child, just a fraction of what he had in my life, it would, be the most rewarding thing I could do. And now, sometimes he sends me his old patients, and that's just, the best day of my life when I see those patients. I'm extremely private about my exstrophy. I don't know, if other patients here are, but the only people in my life that know about my exstrophy are my mom, my dad who was passed, my brother, and my wife. And that's, it. And I went to India this past year with Dr. Shukla, and just kind of seeing all the patients on the floor and all the families, I just thought to myself, there's more I could be doing. And that's why I'm here. But, I wasn't private. I'm not private because I'm ashamed of it. I'm just private because, I don't know what my boss does in the bathroom. I don't know what my coworkers do in the bathroom. I don't know what my friends do. They don't need to know what I do in the bathroom. So that's kind of my thinking on it. When I was a fellow at CHOP, Doug Canning was there, and he would always say to me, before he knew I had exstrophy, he always was telling me that he thought that exstrophy patients had really high IQs. It's one of the reasons why I really love Dr. Canning. But I really believe, he was right about pretty much everything, and I think he was right about that. I mean, just today you've seen it. The only exstrophy patient I know in my personal life is a geneticist in Europe, and so I think it's really I think it's a really special group. So I'll get into the topic here, navigating emergencies. A lot of this is personal experience. So inability to catheterize either per channel or per urethra, or just not being able to void at all. There's we talked about stomal stenosis, or you can get false passages in your channel or your urethra. Some catheters just are defective. None of the companies selling here, but sometimes the like Rob Nels and things like that can be you can get a bad. So you should always have two on you. Always have them on you when you're far from home. I have a personal experience of when I was in high school. I was snowboarding an hour from home, and I didn't have my catheter because my dad took me, not my mom. And I still remember just throwing up the entire car ride home, getting home, catheterizing in blood. And luckily it wasn't perforated, but that's something that you just always have to have on your mind. And don't wait long if there's a risk of perforation if you're augmented. And so what happens? What should you do? How do you if you are in retention and you have this risk of perforation, what should be on your mind? So if you go to the emergency room doctors are probably not going to know what exstrophy is, and the adult urologist there probably will have very limited exposure. So you have to be your own advocate. You have to know your catheter size. You have to know that if you have a channel, they should not blow up a balloon. They should just do a straight catheter. You should, if they're failing to get a catheter in, they're going to try to be heroes and try to get it in. But no, you need to talk about doing a cystoscopy where they scope with with their eyes. And then sometimes residents, I had a co-residents when I was in training who, you know, when an older man would come in retention because of big prostate, they would take a needle and just pop it, you know, a bladder, you know, and but you can't do that in an exstrophy patient. You know, they've had prior bowel work and things like that. So they need to think about it. And a resident probably, you know, isn't that well versed in it. So, you know, you need to get an interventional radiologist probably to do that if you need it. And then you need to know the signs of perforation. So decreased urine output, pain, blood. You start feeling ill pretty quick. You're going to start having fevers, and it's in a history of having not drained your bladder properly. The other thing I want to talk about is UTIs. You know, UTIs are very common in this population. You know, ways to prevent it: not holding your urine for a long time, having good hand hygiene, irrigating, helping to ensure, you know, you complete emptying and preventing stones, and then identifying early signs, knowing yourself, knowing when you start feeling abdominal discomfort. Oftentimes it's, you know, full body, you know, abdominal discomfort. Fevers, it can get a lot worse very quickly. You can go from a cystitis or a bladder infection to a pyelonephritis or a kidney infection pretty quick. So kind of early on, call your doctor and kind of get a culture of brewing. Yeah. So here's some kind of helpful tips about UTIs, things that I've thought about a lot. So know your prior sensitivities. Know if you have an oral option that has worked in the past. So here's kind of a picture of kind of what sensitivities look like to us. You might have access to that in your chart. Know, you know, if an oral option works, and then it's really great to have an infectious disease doctor as part of your team. We as urologists treat a lot of UTIs, but they know the nitty gritty a lot better than we do. And if you can have them on your team, it can be very helpful. And there's a lot of exciting stuff happening in antibiotics right now. They're developing new antibiotics. They're developing UTI vaccines. There's, you know, they're getting earlier culture results. So, you know, exstrophy patients that have recurring UTIs don't have to sit in the hospital waiting for their culture results on IV antibiotics. They can, you know, there's less need for inpatient admissions. And then something just, you know, one point is complex UTIs, which are almost always the case in kids with exstrophy. They need at least a 10 to 14 day course of antibiotics. Don't do a 7-day course. You're just going to run back into trouble. And then another topic is obstructing kidney stones. So this is something that ED physicians are comfortable with, but they're not comfortable with it in exstrophy patients. So, you know, if they're, you know, usually in an adult, they'll take a big scope and go through the urethra to treat a kidney stone. And so if you have a channel, you have to make sure that, you know, they're using a smaller scope and they're not traumatizing the channel. If there's been a history of a bladder neck reconstruction, you also don't want them to ram a big scope into the bladder neck reconstruction. That could stretch things out and cause incontinence. And oftentimes, you know, the ureteral orifices or where the ureters are in the bladder in an exstrophy patient aren't, you know, things have been done. Either they've been reimplanted or you know, there's been an augment, and it's just not that straightforward. And sometimes, you know, if there's a stone, you'll need a nephrostomy tube in the back, which, you know, is just something that you kind of need to know going in. Some things about, you know, post-op after surgery emergencies. So I would say, you know, most of the time after surgery, you know, you're going to be in the hospital for a while, but even after that, consider sticking around for a week or so and just kind of seeing how you do. Post-op assistance is absolutely critical. You know, I'm a urologist, and I had surgery at CHOP, like my last year there. And my wife, and we were moving. And so my wife and everybody left. And I thought, you know, I'm a urologist, I can take care of myself post-op. And I got a staph infection because, you know, it's just so hard to do it by yourself after a big surgery. And so, you know, you really need assistance. I can't stress that enough. And then, you know, monitoring for wound infections, then infections can lead to, you know, fistula development, bleeding, things like that. The post-op period is so critical. If you have multiple tubes, make sure they're draining. Tell your doctor immediately if they're not draining, because you could over-distend the bladder and cause significant issues and risk of infection. And then just kind of general principles, knowing your anatomy. This is very difficult in exstrophy. Pam and I were talking about getting a card and wallets, or, you know, more up to date, an app on the phone to do this. And it's extremely difficult. Like I said, when I was a resident, that's when I first got my op notes from when I was operated as a child, and I got them. And I even as a resident, I didn't necessarily understand my op notes, but have them on you. Like maybe have a picture of them in your phone. So if you do go to the emergency room, you have your op notes. They know if you're augmented, know if you have a bladder neck reconstruction. At Cleveland Clinic, we get a lot of adult urology patients, and one of the patients, my partner was telling me a story of one of her patients had been operated outside, and for an augment, they were going to do an augment, and when they got in, the patient already had an augment. And so, these are things that, you have to be your own advocate and know these things. And then another thing, just, when you walk into an emergency room, they're going to want to do a CT scan. And as Exstrophy patients, you've already been radiated with, x-rays and things like that, and nephrostomy tubes and things like that. So don't let them just whisk you off to the CT scanner every time. A lot of, in pediatrics, for example, a lot of times we'll do ultrasounds, send a culture, and that usually gives us a lot of information. So be your own advocate. Don't let them CT you every time. And this kind of goes to the point. Most pediatric urology teams, especially, the urologists here, very responsive. They want to be involved. I tell my residents, the worst thing you can do at night is not call me at 2 a.m. and try to be a hero. Call us. We don't mind being woken up. And then this last thing, preference towards what you're used to. This is just kind of, we're talking about augment, Trophinov, or just trying to avoid on your own and things like that. And honestly, whatever you do for a long period of time, you get used to, and it becomes your normal. And I think everyone kind of will fall into what they're used to. I don't know. Just a couple difficult places, situations. Public restrooms, like at a sporting event or something, very dirty, very, always wash your hands, and especially if you catheterize, and, it can be hard if you have to catheterize and you go in, if you don't have hand sanitizer, you can wash your hands and keep one hand clean and touch the dirty door with that. Schools, like anytime, and this isn't just Exstrophy, we have a lot of kids in pediatric urology that have to catheterize themselves at school. And every time I talk to the kid at school, I'm looking at them and I'm just thinking back to me and how I used to have basketball practice after school, and there were no doors on the restroom stalls because, kids were doing bad things in the restroom. So they got rid of the doors, and my mom thought I was catheterizing at school. And instead, I was going 14 hours a day without catheterizing, and would go to basketball practice after, get home at 7 p.m. And every time I'm talking to a patient, I'm thinking in the back of my mind, are you really catheterizing? Like, you really gotta, and then college. So, dorms, it can be, you have your own normal, and it can be really fun. I remember when I started, I had a private dorm. And when I got there, the RA really scared my mom and said, oh, he's not going to have any friends. He's down here private. And then by 2 months in, all my friends were like, oh man, we want your private dorm. So that was hard still, because, at that time you don't understand the ramifications of not washing your hands, and you get UTIs because you're a kid. Alcohol, as Exstrophy patient, you can do alcohol. You just can't be the friend that passes out, and you just can't be that. You have to be mature and realize, you can't do that. But absolutely. And traveling developing nations, like I said, I went to India this year. Very hard. In terms of the bathroom situations and things, but you can do it. And kind of back to the point, knowing your sensitivities, your culture sensitivities. A lot of people take like malaria prophylaxis. I took the antibiotic I know that works for me. And yeah. And then, sorry, this is the last one. Just kind of not really the topic of this, but just I really wanted to touch on this, fertility. There was a talk on this earlier, and this is something that's really, I think, important and can be very difficult. So I'm talking about male fertility here. Most urologists who specialize in fertility aren't familiar with Exstrophy. And like we said, most males with fertility should be able to have children through assisted reproductive technology. However, it's a long and hard process sometimes, because for example, my infertility specialist put me on Sudafed, that medicine that was described earlier. But if your bladder neck's closed that's not going to help. And, it's just a matter of knowing your anatomy, the physician having any clue about pediatric, exstrophy, and then kind of, it's really a difficult thing. So I actually published this in Urology, and it's a case report about my story. I don't say that, it's a case report about a patient. And because I just wanted it out there, something that really worked well for me. I have 3 children, and they're all through IVF, and so that was an incredibly long, painful process. Very, my as a surgeon in training, it's notoriously horrible on the significant other, and then kind of imagine that coupled with her having to go through 14 egg retrievals that are very painful, her having to go through multiple IUIs, just the constant disappointment for 6 years before we kind of came to the point where kind of my own research kind of figured out we needed to do this synchronous testicular sperm extraction where, in exstrophy, it's just, everybody's going to be a little different, but sometimes there's oxidative stress on the sperm, and it can, just make the sperm not really good at being frozen. So in this synchronous, you never freeze the sperm, and you do the egg retrieval at the same time as the testy, and you bring them together, the sperm and the egg, and it's never frozen, and much better results. And things like that, fertility specialists and pediatric urologist specialists don't usually come together very often. So it's tough. And so, and then sexuality, we talked about that a little bit already, but insecurity is common when you're young. It gets better with age, and then it's not even really you're comfortable in your own skin. You just realize that most people aren't doing anything with the lights on, and everybody's insecure. So like it's just like you just kind of get it's less important. It's less of a focus, and you realize that there's a lot more to relationships than that physical component, which it's still fine. And then and there's incredible advancements in surgical reconstruction right now, especially. If there's real concerns about, the anatomy, not continence, but the anatomy down, transgender surgery has been fantastic in terms of developments in that regard and reconstruction and transitional age patients. And so, there's no reason. And that kind of comes to this last one that I was shocked when I saw this study that the amount of exstrophy patients with suicidal ideations was that high. I had no idea, and I was shocked. And I can't imagine that's still the case with the current treatments today, coupled with things like this in the community, and hopefully it's a lot less here. And then this is my last thing. This is kind of me as a parent more so than anything. So that's Shaun White. I don't know if you guys know him. He's an Olympic athlete, gold medal winner for snowboarding and skating. So every time I see him, I smile because my son actually was born with transposition of the great vessels, which is a cardiac issue. And Shaun White had something even, more severe, tetralogy of Fallot. And he won a gold medal. So every time I see him on an interview or anything, my son's 7, I just smile and I like to watch and listen because I know he's doing well and he's older. And so, there's a lot of older exstrophy patients here who have done really great things. None of us have won a gold medal, but we're doing good. And hopefully that puts everybody at ease and tells you. And so there's my email. If you have any questions, please reach out. It would be the greatest day of my life when people reach out. I really do. I love talking to exstrophy patients and kind of helping in any way. All right, thank you.
Well, my daughter has tetralogy of Fallot, the one that did all the great things this morning. So I too like that Olympic gold medalist and have turned to his story several times for her. So Dr. Weaver went over a lot of things that could happen in an emergency situation in the ER. And I'm sure a lot of you have gone through a lot of those. I know that I have with my daughter, Anna. And so a lot of those resonate with me. And my thought always is, what can we do to better prepare ourselves as parents when we get into these emergency situations? Because I don't know about you guys, I'm not that organized and I'm always usually pretty reactive. And then I call a scene. But we all know bladder exstrophy is rare and a lot of ER doctors have never encountered it. And when you do walk into the ER, a lot of times you're not even seeing an ER doctor, you're seeing a resident or an attendant. And your emergencies can arise far from your specialist care team. How many of you do not live next to your center of excellence? Yeah, me too. I live in Florida and my daughter's surgeon's in Seattle. So, emergencies aren't happening the week we go for follow-up. They're happening when we're at home. So preparation can really mean the difference between confusion and appropriate care. So we're putting together here at ABC, based on my experiences the last couple of years, on how we can prepare and documentation at home. So we're coming up with at ABC, just like we did the bathroom toolkit, we're coming up with a medical emergency binder, which you'll see out on the website in the next couple of weeks. It's going to have your condition summary in terms and layman terms. It's going to have do's and don'ts if you catheterize, your recent surgical history. If you are allergic to, say, latex or any other medications, the names and contacts of your pediatric urologist, your surgeons, your insurance, and where your specialty care is done. And then we'd like you to keep a copy of this in your home, your car, with your child caregiver, or if you're off at college. I'm actually going through this with Anna now as we're headed off to college. We've spent the last couple of months putting together very detailed information on her diagnosis and history. A lot of our kids don't really know a lot of their diagnosis or history. So we've gone through the process of listing that. Her medications, her dosage, again, allergies, emergency protocols, as Jack said, what to do in a crisis medical situation at college. We're not there as parents anymore to watch over that. The list and the names of their contacts and all providers, make sure that they have a copy of their insurance card. If you haven't done so, we all know when they turn 18, we no longer have access to their care. Wide eye opening for me, because I can't get into either one of my daughter's records anymore, nor do I have power of attorney over them right now. It's something that we should think about as parents of children that are growing up. Do we have that medical power of attorney? So if they are off at college, we can, in an emergency situation, step in and help care for them. Again, put this in a binder and make sure that they have someone in their dorm, and give it to their care providers there, and have it on discs or Google Drive so you can have access to all of this. Just be prepared. A lot of families are having their kids or adults wearing the medical ID wrists. There's a lot, they're pretty cool now. I mean, when Anna was young, the best thing they had was like an Apple Watch. Well, now there are these things where you can have the QR codes, your care is all right there. They can just scan it, and doctors can see when you walk in what all of these documents can be in one place on your wrist. We're also going to have a letter template that we're going to have on the website that you can bring to your urologist, and it's going to be an emergency protocol letter. It's, again, one page that you can carry with you, have you with you at all times, a diagnosis and the explanation for any non-specialist that you might see, the key do's and don'ts, which Dr. Weaver went over, emergency treatment instructions, and how to contact your primary urologist, and instructions for hospital transfer if needed. And really advocate on this. I've had to. A lot of times they don't want to let you transfer. They don't want to let you talk to a specialist. The attending will just insist that they know what to do. But keep this, again, in digital and in paper copies. When you get to the ER, advocate. If you have an opportunity, I've done this before. I live in a small beach town. My closest it's not even my center, but it's a hospital. I have to drive to Miami. It's a 3-hour drive in case of an emergency. Our small town couldn't even handle an emergency UTI and a possible perforation. So I'm 3 hours away from the nearest care. So I call ahead and I let them know I'm coming. So they know that when we get there, that they know that we're coming. So if you can do that and let the emergency room know ahead of time, maybe they can call the urologist on call and let them know that you're coming. Ask if they've ever treated bladder exstrophy before, and if they have the right equipment to even do any of the tests that they need to be done. Again, provide them with that one-page letter upon arrival. You could waste valuable time. You could waste 4 hours waiting if you don't give that information right away. Be direct and calm, but say, my child has bladder exstrophy, a rare condition. Improper handling can cause harm. I have emergency protocol from my doctor, and I want to contact a specialist. Provide them the one-hander, provide them the your binder, provide them the letter from your urologist and the QR code if you have it. And again, you have to be a strong advocate sometimes, and if needed, threaten that you're going to transfer and insist on speaking to the pediatric urologist on call. Another thing that would be handy is to pack a to-go bag. Have it, especially for the younger. Have a bag ready to go in your car, in your garage, or next to your door. Have that binder ready. Have catheter supplies with you, because I don't know how many times if you've been to the ER and they want to do a UTI and they don't even have a catheter available for you to even do a catheterization. So make sure you bring your own catheter supply so you have the right size and the right catheter for your child or for yourself. For your children, have some comfort care items for your child. It's going to be a long night probably. Make sure you have a cell phone charger. Nothing worse is you're sitting in the ER for 6 hours and your phone dies. And again, the printed emergency protocol letter that you can always have on hand for you. Keep this in your car, keep it at the door, or if your child's off at school, have them keep it in the dorm. Also educate the caregivers in your schools. If it's camp, you're off at school, provide the nurses and teachers with this one-pager. We already have on our website how to navigate the bathroom policies at the school, but now we're going to be adding how to navigate emergency situations while at school. Make sure that they have an emergency contact list in their wallet or on their iPhone. Provide them with the ABC's bathroom toolkit. Perhaps do a mini training every year as you go into the school for the next year and role play with your child and their teacher or the child and the school nurse on what to do in emergency scenarios. And again, you could leave a copy of the go-to bag at school or in their locker, or at least have a list of that. When you're advocating at college, you got college accommodations, Jack, yes? Mm-hmm. My daughter Anna did too. It can be done. I get questions about that all the time. What kind of accommodations do our child with bladder exstrophy get at college? Well, Anna did get a private dorm because she went through the process. Dr. McGarrian had to write her a pretty detailed letter. She received the letter. It was a process. She had to do an interview with the ADA community at college, but she was given accommodations. We have gone through the last 2 months communicating with the key staff at her university, not only with the dorm parents, but with the people inside her college of study. And then we are now in the process of setting up local resources. So she does have a local urologist in Syracuse. We're going to meet that local urologist and make sure that they have all of the emergency binder information, her history, and that we'll be in contact with, at this point, Paul McGarrian until Kim gives me an adult provider that we can go to. But again, all of this transitional care, and if we just have a lot of this readiness up front, then when we are hit with some of these emergency situations, we're not in a panic situation. All of this allows our children the freedom to thrive. Encourage the independence among the kids, depending on what age that they're at. Have them help in ordering their own supplies. Have your children at the right age understand what their own insurance needs, how to read their insurance card, how to call the insurance company. Help them gradually build confidence before they head off into middle school, high school, and into college. Make sure that they know their condition and how they can tell others what to do in case of an emergency. A little bit different than talking about what is my condition in a social setting. This is what is my condition in an emergency setting? So they understand what their own condition is. What to do. Does your child know if you're not home, when and how to call 911? Do they know what to do if their symptoms worsen? Teach them how to communicate with the professors about their health-related absences or their teachers about their health-related absences, so they're not penalized if they're in emergency situations or having unplanned surgeries during the year. You know, as a final reminder, you and your child are the experts on your child's needs. Emergency prep builds peace of mind. Help your providers, help your child. With that, I will end.